Many Africans are increasingly becoming frustrated and concerned over the endless questions on whether the continent is recording enough COVID-19 cases. As of the morning of May 2nd, the CDC Africa reported a little over 40,000 cases on the continent from 53 countries. Two epidemiologists from the African Field Epidemiology Network, AFENET, which operates in 31 countries in sub-Saharan Africa, assured me that a great deal of attention has been paid to the pandemic, even before the first cases were detected on the continent.
We've been working with ministries of health across the continent for the last 15 years, and we've been building capacities for disease surveillance, outbreak investigation, and response.
When the epidemic started in China, it was a question of when, not if, it will get to Africa.
So initially, before governments closed airports, we had people traveling from across, and we knew this was the only route through which COVID could enter Africa. So immediately we support from our member programs, we deployed field epidemiologists at points of entry. And now eventually when the cases started coming in on the continent, we activated what we call the AFENET disease detectives.
These are well-trained cadre of staff that can be rapidly mobilized and deployed to respond to public health emergencies across the continent.
And these are not subjected to a lot of bureaucracies in terms of getting clearances for them.
AFENET has also been working closely with Africa CDC by building additional capacities in member states, including training public health workers in lab diagnostics and other areas.
The capacity to test has improved greatly over a short period of time.
Initially, we only had 2 labs, in Dakar, in Senegal, the Institute Pasteur in Dakar, and also in South Africa. But as we speak now, from those interventions and support by other partners, over 44 countries now can test COVID.
However, I must quickly add that the testing capacity in the continent is still suboptimal, with wide variations across countries. It is likely that when we reach optimal testing capacity, many more cases will be reported. I've heard some people make the argument that the only reason why Africa is reporting low numbers of cases is because of the low level of testing. As I've said already, yes, we haven't reached optimal testing levels yet. But to make the point that the low level of testing is the only reason why we are reporting low level of cases is to ignore all the interventions, is to ignore all the continental efforts that have been put in place to prevent the transmission of the diseases. The other point that might account for the low numbers that we are seeing is what is being investigated. The role of temperature, the role of humidity, and the transmission dynamics of COVID-19 is being investigated. And some of these studies are reporting that higher temperatures, higher humidity might reduce the rate of transmission. Indeed, one such study has reported that an increase by 1 degree Celsius of temperature is capable of reducing the transmission rate by 13%. I agree that many more studies need to be done to define clearly the role of temperature and the role of humidity in the transmission dynamics of COVID-19. But what has been found already by some of these studies provides food for thought.
The epidemiologists caution against complacency as some countries have started reporting community transmissions. Now more than ever, African countries must work together and implement proven measures or risk having repeated outbreaks.
And how can I be certain about that? Our interconnectedness guarantees this.
Regional bodies like IGAD, ECOWAS, as well as the East African community have also been on top of preparedness and response to the pandemic. And AFENET says that this should go beyond COVID-19. So there you have it. The continent has not been sleeping. Florence Blondell here in London.